Hello and welcome back to Focus Atlanta. June is Men's Health Awareness Month, and we feel like it's a perfect time to talk to men about making their appointments to go see the doctor.
The Prevent Cancer Foundation does an annual early detection survey. And what we found was that 7 in 10 adults in the U.S. are behind in at least one routine cancer screening. So what that means is 7 out of every 10 of us are missing the opportunity to prevent a cancer in its entirety or detect it early when we have the best shot at health.
The Prevent Cancer Foundation's annual early detection survey found that 65% of U.S. men are behind on at least one routine cancer screening.
So it's interesting on the not being screened part. What we know is that regardless of race, ethnicity, or gender, actually the number one reason people aren't getting screened is they simply didn't know they needed to be screened. So we really need to be talking about it more, and I'm grateful for you for having this conversation because people just don't know. The data gets interesting for men too, because what we found out is that about 20% or more than 20% of men are not scheduling their own medical appointments. So a partner, spouse, relative is scheduling those appointments for them, and we want to make sure men have the information they need to take care of their own health.
33% of men say they worry about experiencing stress while waiting for the results of routine screenings.
When a cancer is detected early, like I said, you have a chance of even preventing it in its entirety. For example, when you look at colorectal cancer screening, colonoscopy is preventive because when you have that procedure, the doctor can look to see if there are polyps there and remove those polyps before it even becomes a cancer. So you're eliminating it in its entirety. And when a cancer is detected in its earliest stages or early stages, then you have more treatment options available, potentially less invasive treatment options. So really the data is on average when a cancer is detected early, the 5-year survival rates are 90%. When it's detected in its later stages, then that drops significantly. So we all have a chance. We don't want to do it. People often don't want to go in because they don't have signs or symptoms. They feel great. They don't want to go in and have this appointment. But that's your best time to do it because it really gives you more opportunities to continue thriving.
More than a third of men reported that they're better about reviewing their bank account or credit card statements than getting their routine cancer screenings.
Lung cancer is the number one cause of cancer death for men and women, and it is the screening with the lowest uptake. Don't be ashamed, don't be embarrassed. If you have a smoking history, talk to your provider, get the screening if you qualify for that. So, I want to make sure we talk about that too. You have skin cancer screening as well, oral cancer screening, which is happening at your dentist. You may not realize it, and if you're not sure, ask. Oral cancer screening is important to have as well. People can go to preventcancer.org and find a list of screenings they need at every age. They can find the list of low and no cost screening locations, and they can print out a personalized screening quiz that they can take with them to their provider so they don't have to remember everything. You can say, here's what was recommended, let's talk about each one of these.
Remind the men in your life to get their cancer screenings on time. And stay tuned for more Focus Atlanta. We'll be right back.